Compare NAFLD versus AFLD, non-alcoholic and alcoholic fatty liver. Non-alcoholic fatty liver disease or NAFLD and alcoholic fatty liver disease are two distinct conditions that involve the accumulation of fat in the liver cells. While they share some similarities in terms of symptoms and features, there are key differences that can help distinguish between the two. Here are some factors to consider. Always consult your health care professional before making any changes to your medication or lifestyle. NAFLD is a condition that is not associated with excessive alcohol consumption. It typically occurs in individuals who have metabolic risk factors such as obesity, insulin resistance, or diabetes. Alcoholic fatty liver disease or AFLD, as the name suggests, is directly related to excessive alcohol intake. The liver damage in AFLD is primarily caused by the toxic effects of alcohol. I had a friend of a friend, who used to heavily drink daily, and doctors told him, as he said, that he had non-alcoholic fatty liver. That decision was based on his statement to doctor, not based on any scientific test. I also have another friend, waiting for a liver transplant, who has the non-alcoholic fatty liver. We worked with him for 10 years, and I know he is not a drinker. According to most experts, it is a two-way relationship. NAFLD increases the risk of developing type 2 diabetes. Type 2 diabetes promotes the progression of fatty liver disease to a more advanced form. According to an article published on the National Institutes of Health, the major cause of non-alcoholic fatty liver disease is insulin resistance. I have faced the situation where doctors or endocrinologists recommended insulin when oral tablets are not working, without checking for insulin resistance. So, what to do? I changed to an endocrinologist who is more logical. Medical history. The prevalence of NAFLD has increased by more than 50% in the last few decades, according to an article in Journal of Hepatology. NAFLD is often linked to metabolic conditions such as obesity, insulin resistance, type 2 diabetes, and high cholesterol levels. AFLD is associated with a history of chronic and heavy alcohol consumption. NAFLD, elevated liver enzyme levels are common but can also be seen in other conditions. AFLD, elevated liver enzymes, particularly gamma-glutamyl transferase (GGT), are more likely to be present and may be more significantly elevated in the context of alcohol abuse. NAFLD, typically diagnosed through imaging studies like ultrasound, CT scan, or MRI, which show fat accumulation in the liver. AFLD, similar imaging findings of fatty infiltration may be present, but a history of alcohol abuse and excessive drinking is crucial for diagnosis. Liver biopsy. NAFLD, a liver biopsy may be performed if the diagnosis is unclear or if there is a need to assess the degree of inflammation and fibrosis. AFLD, liver biopsy may also be used to confirm the diagnosis, especially in cases where the history of alcohol consumption is uncertain. Other considerations. NAFLD, often associated with metabolic syndrome and can occur in non-drinkers. AFLD, typically seen in individuals with a history of chronic alcohol abuse. It is important to note that both NAFLD and AFLD can coexist in some individuals. Additionally, other liver conditions, such as viral hepatitis or drug-induced liver injury, may have similar presentations. Therefore, accurate diagnosis often involves a comprehensive assessment of medical history, laboratory tests, and imaging studies by a healthcare professional. If you suspect liver disease or have related symptoms, it is crucial to consult with a healthcare provider for an accurate diagnosis and appropriate management. Final take-home message is, if you have diabetes, limit your drinking. Do not forget to click the like button and subscribe. Thanks very much for watching this video. Up above you see a video related to health. It will be more helpful to you and your family. Subscribe to my channel. See you in the next video.